Good morning, Trinidad and Tobago, and happy Caribbean Wellness Day. Welcome to the Ministry of Health's virtual media conference on the national COVID-19 response. Here in studio with me are the Honorable Terence Dayal Singh, Minister of Health, Dr. Roshan Parashram, Chief Medical Officer, and Ms. Alicia Baksh, CEO of the Northwest Regional Health Authority. I'm Candice Alcantara, Manager Corporate Communication at the Ministry of Health, your moderator this morning. And we go straight to the Chief Medical Officer for today's clinical update.
Hi, good morning. Thank you, Ms. Alcantara. Good morning to the Honorable Minister. Good morning to the CEO of the Northwest Regional Health Authority, members of the media, members of the viewing and listening public. So we will begin this morning with the clinical update for September 10th, 2021. Total persons tested to date at both public and private facilities, 323,983. Over the last 24 hours, we would have reported 182 new cases, taking our total since March 12, 2020 to 46,735. Of those, 41,515 have recovered, and total active cases to date are 3,861. Of those in home isolation, we have 3,319. In hospital at present, we have 291 in all across all the hospitals in Trinidad and Tobago. Step downs are 69, at quarantine sites 126, and so far we have 1,359 deaths, and condolences go out to the families of all those persons who would have lost loved ones during the pandemic. In terms of our hospital level, we're looking at a total occupancy of about 35% between both islands. In Trinidad, 36%, in Tobago, 28%, has been holding somewhere between this level and just over 40% since the middle of July, the 15th of July. In terms of our pediatric cases in Trinidad, we have 9 cases, all ward level, all stable. And just a little breakdown in terms of our major hospitals. At the Couva Hospital multi-training facility, there are 58 persons, 11 in ICU and 14 in HDU. Coral Hospital now houses 25, and the Augustus Long Hospital 45. The other hospitals remain stable in terms of the number of cases that they have. Ms. Alcantara, that brings me to the end of the brief clinical update for this morning.
Thank you very much, Dr. Parashram. And the CEO of the Northwest Regional Health Authority will now provide an update on vaccination efforts in that regional authority.
Honorable Minister of Health, Chief Medical Officer, Ms. Alcantara, members of the viewing and listening public, media personnel, good morning. This morning I am going to speak to the vaccination rollout activities at the Northwest Regional Health Authority. So I would firstly like to start with a brief breakdown of the doses that we have administered to date. So basically, at the Northwest Regional Health Authority, we have administered a total of 158,478 doses. And those are disaggregated as follows. First doses, 84,386. Second doses, 72,635. As it relates to the different vaccines that were available at each of our sites, the AstraZeneca vaccine, we would have administered a total of 34,241 doses. 18,719 of those were first doses, and 15,522 were second doses. Similarly, with the Sinopharm vaccine, we would have administered 115,206 doses. First doses would have been 59,663, and second doses 55,543. As it relates to the Pfizer, we would have administered a total of 7,574 doses. 6,004 of those were first doses, and second doses were 1,570. And with respect to the one shot and done, which is the Johnson & Johnson vaccine, to date we would have administered a total of 1,457 doses. So that's a brief overview with respect to the administration of vaccines within our catchment area. As it relates to the actual sites that would have been administering those doses, we would have been at the mass vaccination site, which is located at the paddock. We had our drive-through, which was originally located at the heliport, but then relocated at the stadium around the 27th of August. We also did health centers and elderly homes and shut-ins. I just want to give a little focus to the mass vaccination site and the drive-through to really explain to the public the type of numbers and persons we would have done at those sites. So at the paddock alone, which is our mass vaccination site, we would have administered 70,008 doses. And at the drive-through, we would have done 12,666 doses. And those numbers are really a testament to the phenomenal job the team at those sites would have been doing over the period of our vaccination outreaches. And of course, it's a further testament to the citizens of Trinidad and Tobago in terms of accessing the vaccine and ensuring that they are protected against the COVID-19 virus. Furthermore, in terms of the tenets that the Ministry of Health has been driving in our vaccination activities, being availability and accessibility, we have now endeavored into conducting outreaches, which is more or less bringing the vaccines to you, creating more accessibility. So you no longer have to visit a health center or a mass vaccination site. We are coming to locations that we can reach to you. So thus far in our outreach activities, we would have done approximately 884 doses. So these outreach activities would have spanned between places of worship. We went into different churches, mandirs, mosques. We also partnered with the various members of parliament and councillors within our catchment area. And we did activities at community centers such as the Mount Hope and Mount Lambert, Patna River Estate, Sugrin Trace. We also did activity outreaches at coastal areas in the Las Cuevas and Maracas Bay area. Presently, our recent activity are at malls. So today, we are at the Long Circular, West Mall and Starlight Shopping Plaza between the hours of 1 p.m. and 6 p.m. Vaccinate and shop. You can't get it easier than that. So come visit us at our various booths in these different malls, and we will be able to provide you with a vaccine. In light of our continued outreach activities, yesterday the Ministry of Health would have launched its transit vaccination drive at the City Gate. And of course, Northwest had the pleasure of hosting that drive as it was in our catchment area. So we were there between the hours of 7 a.m. to a little before 11 a.m. And I'm pleased to announce that 68 persons were vaccinated during that time, which I think are promising numbers given the short space of time we were at that location. And I'm sure the Ministry of Health will be reviewing that data and coming up with more outreach activities where we can reach the public in a greater way. Even today, the Northwest Regional Health Authority has partnered with the Honorable Minister of National Security, Member of Parliament, Mr. Fitzgerald Hines, in his vaccination drive. So today, between the hours of 9 a.m. to 3 p.m., we are at the Beetham Community Center, the St. Bob's Basketball Court, and Laventil Rhythm section. So I just want to encourage everyone who are living within those general geographical areas, come on down. We are there from 9 a.m. to 3 p.m. Come and get your vaccine. We are there willing to serve you and are eager to administer the vaccines to each and every one in that area. As it relates to our future outreach activities, of course, Northwest will be looking at going into more communities and, of course, more places of worship. Our next big event will be at the Brian Lara Promenade at the end of this month. And furthermore, we'll be looking at supermarkets, major markets. We are just trying to reach each and every one of you so we can offer you the vaccine in an easy and accessible way. As it relates to the accessibility of vaccines, you are able to visit any one of our health centers between the hours of 8 a.m. to 2 p.m., Monday to Friday. You can visit the Paddock area, which is our mass vaccination site, Monday to Friday between the hours of 8 a.m. to 3 p.m. And our drive-through, which is now located at the stadium, Monday to Friday, 8 a.m. to 4 p.m. With respect to persons who are due their second doses at the National Stadium drive-through site this weekend, we have tried to reach out to each and every one of you to advise that the drive-through is not open on the weekend. However, you can access your second dose Pfizer at the Paddock, which is open up until 6 p.m. Saturday and Sunday. And if not, you can visit us during the week at either the paddock or the drive-through site between the hours of 8 to 3 at the paddock or 8 to 4 at the stadium. So you are able to get your second doses either this weekend at the Napa site or during the week at our sites. In wrapping up with respect to my presentation on our vaccination efforts, I just want to take the time to thank Team NWRHA as they continue to navigate during this pandemic to meet the needs of our clients and stakeholders, particularly the persons who are involved in the vaccination activities. The resources are finite. Persons work long hours, sometimes 7 days a week, because we know the importance of vaccination. Vaccination is the key to getting ahead of this COVID-19 virus. And the healthcare workers are ready and willing and have demonstrated that they are willing to do their part in the fight against the COVID-19 virus and the wider national perspective. And all we are asking is that the citizens of Trinidad and Tobago just present themselves for the vaccine. Come to our sites, come and access the vaccines. And together we will be able to return to some form of normalcy. And before I end today, I just want to recognize Wellness Week. This week is observed yearly in the month of September and is geared at increasing awareness and promoting activities to address NCDs, including mental ill health. The adoption of health promotion aids does not only assist in preventing diseases, but also offers support for the empowerment and engagement of individuals and communities through collaboration for promoting health and well-being. Healthy lifestyle changes, getting annual checkups, and improving relationships are some of the objectives in the fight against NCDs. The slogan for the 2021 campaign is Building Equitable Communities, following the call to action from the World Health Day to eliminate health inequities by building a fairer, healthier world for everyone. Thank you.
Thank you very much, CEO, for just reminding us of all the ways that we can get vaccinated. So many locations, so many opportunities, and of course the malls today. We go now to our final presentation this morning from the Honorable Terence Dayal-Singh, Minister of Health.
Hi, good morning, Candice. Thank you very much. Good morning to the Chief Medical Officer. Good morning to CEO Salisha Bash. Good morning to ladies and gentlemen of the media and the listening and viewing public wherever you are. I just want to start off by reiterating what CEO Bash said. For those parents who want to get the second shot of the Pfizer vaccine or the first shot for your children, the Napa site in Port of Spain is open this weekend. Okay, thank you very much. So let me bring you up to date on where we are with our vaccination numbers so far. So could we have the first slide? Great. So the first slide shows that to date, persons with first dose, 543,072. Broken down by the different sectors: Northwest, 74,000, North Central, 101,000 roughly, ERHA, 57, Southwest, 130. Bearing in mind that Southwest has the highest population that they see about of all the RHAs. TRHA 18,679. This is a bit concerning, and we will speak about this a little later on. Other state agencies 12,661. Other agencies 148,739. Total second dose to date 429,480. Those who have completed their vaccination schedule, when you add the one dose, one shot and done, will now be 9,011. So you add that to 429,480, you get 438,491. When we look at the graph, if the graph is there, that shows you where we are going. So the green line shows you the number of persons vaccinated with their first dose. 543,072, and then the aquamarine line is number of persons vaccinated with their second dose, And then you have to add to that the 9,000 one shot and done. I just want to mention that parents, thank you very much for the graphs. Thank you very much. I just want to mention, when we disaggregate the figures, what are some trends we are noticing, whether they are good trends or disturbing trends. What we have noticed with the Pfizer, since we opened up the Pfizer vaccines to the general public this week, and I don't want the public to be misled by the numbers, many more adults now are taking advantage of the Pfizer vaccines as opposed to children. And while that is good for the adults, it is not so good for the children. So I'm giving you the glass half full perspective and the glass half empty perspective. With children between the ages of 12 and 17 to 18, we started off with 3 consecutive days of about 3,004 per day. That has now dropped to the past 2 days of 550 and yesterday 549. So don't let the numbers lull us into a sense of complacency, because when you disaggregate it, more adults are taking advantage of the Pfizer vaccines, but parents and children, you are not taking advantage of it, and your numbers have plummeted to about 1/6 to 1/7 of where we started at. So the message is that we need our children 12 to 18. The total cohort in that group for the school age population, which is 90,000, only 33,540 have been vaccinated with their first dose so far. So just over 1/3. So we are not out of the woods yet with our children 12 to 18, sorry. Of that figure, we have to minus 230, which is the migrant population, 12 to 18. So parents and children, we really need you all to step up to the plate in the coming couple of weeks, because why? Your opportunity, your window of opportunity to access the Pfizer vaccine will start to close because of expiry date issues, that we have to administer your first dose by around the middle of October to the end of October, because we have to administer your second dose within 3 weeks, and these vaccines expire at the end of November. So children, your window of opportunity for the Pfizer vaccine is going to start to get narrower and narrower. And if we pay attention to what is happening globally with the Delta variant, and I don't know if the CMO will speak about this, it seems to be going after children more and more. So, a word to the wise, we need to get our numbers up with our pediatric population, 12 to 18 up. We have gone down from 3,004 to 549. So that's the glass half empty part of it. Our pregnant population, since we opened up Pfizer to the pregnant population, we have done 366. Slow but steady, but pregnant women, especially in your second and third trimester pregnancy, take advantage of the vaccines. I want to talk a little bit about the one shot and done initiative. Since we started it, we have vaccinated 9,011 persons with the one shot and done initiative. Yesterday at the malls, I'm going to give you a total breakdown of what happened at 7 malls and Gulf City. So in the West, we were at West Mall, Long Circular Mall, and Starlight. Those 3 malls combined, West Mall did 18, which is a bit low. Long Circular Mall 37, decent. Starlight 20. So in that area of the West, Digger Martin and so on, we did 75. We could do better. Trin-City Mall by itself did 73. The 2 South malls, Gulf City did 64, C3 did 26, so they did 90 in total. And this is the area of concern now, the Tobago Mall, Lowlands Mall, the 12. So I really want to make an appeal to the citizens who reside in Tobago. I want to join with the Honorable Prime Minister when he spoke at the end of the retreat last week, lamenting what is happening in Tobago. I want to join with the two members of Parliament, the Honorable Shamfa Kajo and Ayana Webster Roy, the Chief Secretary, the Secretary for Health, who have all lamented the low rate of uptake of vaccines in Tobago. For the Tobago Mall yesterday to do 12 speaks to a level of vaccine hesitancy in Tobago that we need to really talk to the persons of Tobago. Please come out and get vaccinated. The persons in Tobago who are encouraging you not to be vaccinated, they will not be there for you when you are ill. They will not be providing the hospital space, and Tobago is already challenged. They will not mind your family if you die. They don't have your best interests at heart. So I'm appealing to citizens who reside in Tobago to come out and get vaccinated. The Citygate initiative yielded 68, pretty good. So yesterday's outreach, one shot and done, across both islands yielded 318 doses. So yesterday gave us our best numbers as far as the one shot and done. Yesterday, we were able to do 984. What does that mean? It means that persons who access the one shot and done initiative, they get one shot, and then within 2 weeks, they are considered fully vaccinated. They don't have to come back. And that was the main advantage you heard people at Citygate talking about yesterday. They don't have to come back. They don't have to seek out another site, another venue. So another couple half glass, half empty messages. The adult population in Trinidad and Tobago, roughly 510 persons have been vaccinated. The glass half empty part of it is we have another 500,000 to go because our adult population is 1 million. So we have a way to go. These figures are halfway decent, but we have a way to go. We have the vaccines. We have it distributed across all 109 health centers, 20 to 30 odd sites, also in addition to the centers. We have it in malls, transit hubs. It is easy, it is convenient, it is safe. Just get vaccinated. Also, a general reminder for those who are under the two-shot regime, please seek out the sites. We always publish the sites where you can go for your second shot, because you are not considered fully vaccinated until 2 weeks after your second shot. What can the population look forward to in the coming weeks as we make the vaccines more and more available? In addition to the outreach on malls and at Citygate, we are taking advantage of the 2 month-end weekends we have coming up. We have already started to plan for the last weekend in September and the first weekend in October. We'll be going out with major drives under the RHAs, who will be contacting their various MPs, their various business associations, and we are going to be having 2 weekends, Fridays and Saturdays. So that's 4 days of activity in the following areas. Port of Spain, hopefully on the promenade. We'll be working with the mayor, Doma, and so on. We want to target Tunapuna, Sangre Grande, Central Trinidad, and South Trinidad. We'll be coming to your spaces where you're doing your shopping, you're doing your market, your groceries, and so on, and targeting you with this one shot and done initiative, which by all reports from the malls and Citygate yesterday, people seem to love. So we are going to be pushing this. And it's ideal for that type of setting. You just come in, you get vaccinated. We see you, we thank you, we love you, and we don't have to see you for a second shot. Not that we don't want to see you. But it's safe. We are making it highly convenient. And we are just asking people to do their civic duty. Do this now for Trinidad and Tobago. Do this for your family. Do this for yourself. Do this for country. So that is the vaccination update. There's just one more piece of information. I have been authorized by the Honorable Prime Minister to say that the following industry will be a part of the TT Safe Zone initiative in October, in addition to the casinos, the restaurants, and so on, that the betting shops under the Bookmakers Association of Trinidad and Tobago will be allowed to open when the Honorable Prime Minister presses that particular trigger or buzzer under the TT Safe Zone arrangement. So we are zones which are gearing up to be opened once our numbers look good, to get all your employees vaccinated. That is part of the proposal, that all your employees be vaccinated. So everybody working in a racing pool, a betting shop under the Bookmakers Association of Trinidad and Tobago, please urge your employees to get vaccinated, because you will have to provide some sort of proof of vaccination for your employees and customers as we move forward. So thank you very much, Candice, for the few minutes. Thank you very much.
Thank you very much, Minister Dayal Singh. We go now into the question and answer segment. Members of the media, please remember to ask 2 questions, no more than 2. Ask both at the same time, and let us know your name and the media house that you represent before posing your questions. We begin with questions from CL Communications.
Adeline Singh, Caribbean Lifestyle Communications. I just wanted to find out, I know Minister touched on the Citygate vaccination site and the number of people who were vaccinated there yesterday. I just wanted him to expand on how did he think the Citygate vaccination site went when it comes to the uptake that or the target that they're looking at. And then secondly, is Trinidad going to provide support for any kind or of any kind to Tobago to deal with the continuous rise in the number of cases over there? And of course, talk about the uptake of vaccine by young people. Is the ministry satisfied with that uptake? Thank you.
Thank you. So you got in an extra question, but that's all right. So the 3 questions, let's deal with them one at a time. The Citygate experience yesterday was decent, was good. 68 was good. It was our first time going in there for COVID-19 vaccines. We have been there before for flu vaccines. So 68 there was good. What was good about it was that we did this in only 3 hours. So that's a good return on our investment. What was also good was the divergence of persons geographically. You got people from Blanchisseuse, Grandi, Shogunas, the Beetham. So it means all of these people now can go back to their communities as ambassadors for the one shot and done. As opposed to when we go into a community, you're only talking about what is happening in your community. It was a good opportunity for us to provide information. We gave out a lot of flyers. I myself stood up, gave out flyers to persons disembarking from their buses, addressing the 3 major issues that research is saying what people want to know. They want to know what is EUL. Our flyers gave out that, had that information. Why was the vaccine developed so fast? A continuing question that comes time and time again. And the 3rd one about side effects and so on. So we were able, in that compact setting, to do that. So the benefit is not only the 68 persons, the benefit is that we gave out information to a couple hundred people. When people were lining up for buses, I myself went on a bus, gave out information. Same thing we did at the malls. We have those same flyers at the malls. So the benefit is not only in the 68. The benefit now is that a few more hundred people will have information. On the issue of Tobago, yes, we sent across a team to Tobago to spend 3 days, Tuesday, Wednesday, Thursday. They were supposed to have come back tomorrow, and we'll be getting a report on Tobago's capacity. It is no secret that Tobago has a particular issue with ICU. We would have met with folks at TRHA weeks ago to advise that they need to ramp up their ICU response. However, the big solution for Tobago, where they are limited in physical resources, is vaccination. And as I said, those persons in Tobago who are listening to others not to be vaccinated, they will not be there for you when you get ill. They will not take care of you. And if you die, they will not be there for your family. So we have a particular challenge which is amplified in Tobago to an extent it is not amplified in Trinidad. Yes, we have the same challenge in Trinidad, but it is more amplified in Tobago. The issue of young persons, as I indicated, the figures for young persons have gone down significantly from the initial rush, which you expect of 3,004, 3,005 a day, to 2 consecutive days of under 600. Yesterday we did 549, and the day before we did 550. So again, in Trinidad we have our own challenges, and in Tobago. So, what is the message? The message is, parents and guardians, let us do right by our children. Let us do right by the next generation of leaders. Let us do right so that they could go back to some sort of normal schooling environment. Let us just do right by our children by getting them vaccinated. The numbers have declined considerably. So I hope I have answered your 3 questions. Thank you very much.
Thank you, Minister. And now questions from TV6, please.
Hi, good morning to the panel. Alicia Boucher from TV6 here. My first question, Minister, can you tell me how much more, in terms of if you factor in the Pfizer vaccines that would have been reserved for the second dose of the students who were vaccinated, together with the 25,000 that was set aside for adults, how much more, an approximate figure that we actually have to vaccinate our students, and are there any contingencies to prevent these Pfizer doses from wasting as they come to the expiry in November? That's my first question. And it was brought to our attention that the Seventh-day Adventist Hospital dialysis unit, that they are unable to get registered nurses skilled in phlebotomy to work at the organization, and there are persons who are concerned that their dialysis treatments may be in jeopardy, and we're told that the amount of days that they're supposed to do dialysis, that those days are being reduced. So I just wanted to find out if the ministry is aware of the situation and what would be done. Thank you.
Thank you very much. So as you know, the Seventh-day Adventist Hospital is a private institution. We do use them to provide dialysis services, and the EPI, not the EPI, the EPP program, who sends dialysis patients there, will certainly look at that, because all dialysis centers are supposed to report to us on their readiness. On the issue of students, yes. So with the Pfizer, we got in just over 300,000 doses, 305,000 doses. It's a 2-dose regime, so divide by 2, so roughly we can vaccinate 150,000 individuals. Of those 150,000, doses are reserved for 90,000 persons between the ages of 12 and 15. So when you minus 90,000 from 150, it means you have 60,000 doses left. The Honorable Prime Minister did indicate last week that 25,000 shots, 25,000 adults can benefit from this. So there are more than enough doses for the children 12 to 18. The issue is getting them to come for their shots because we need parental approval or guardian, either parents or guardians. And that's why I made a plea in my opening statement that the rate of vaccination of that age group has dropped from 3,005 for the first 3 days, then it started to go down to under 2,000, then under 1,000, and now we are down to under 500. That is not a good place to be. So my appeal again to parents and guardians, let's do right by our children. We are not doing them any favors by not vaccinating them. And for those adults, don't transfer your fear, because the information coming back to us is that many children do want to be vaccinated, but their parents are preventing them and transferring their fears and misinformation onto children. Because this cohort of the population is a lot more informed. They are not buying into the conspiracy theories. And many of them want to be vaccinated, but we need consent. So thank you very much, Alicia, for raising that very important issue.
Thank you very much. We go now to AZP News, please.
Good morning, everyone. My two questions. This is Suan Weil from ACP News, and my two questions are for the minister. Forgive me if this has already been addressed, but will the Ministry of Health be making recommendations to the Ministry of Education to implement a policy regarding vaccinated and unvaccinated teachers? Because the question is being asked, can an unvaccinated teacher teach a class of vaccinated children? And this is in accordance with the October 4th opening for in-person classes for the forms 4, 5, and 6. And given that budget day has been announced, what can the ministry say finances would be needed for the most coming for 2020, 2022? And I do have one additional question for later on. Thank you very much.
Thank you very much, Suan. Two good questions. So the issue of vaccination status of teachers is one that will be led by the Ministry of Education. Whatever technical support they wish to have from us, we'll be happy to provide it. On the issue of budget day, I think now is a good time because I have the figure. I had to do it for the retreat last week. The two burdens of COVID on Trinidad and Tobago are one, on the personal side, how many persons have died, and our deepest condolences go out. Those suffering from long COVID, those who cannot work because they have contracted the disease. But you asked an important question about budget day. We did an analysis of what the financial burden is of COVID on the healthcare system. The three major areas of expenditure for COVID that you, the taxpayer, have spent, and ask yourself, could we have used this money for other things, which is infrastructure, HR, and consumables. From the start of COVID, preparing from COVID to now, the Ministry of Health has spent $480 million on the COVID response. And that number, is it sustainable? We will have to continue to provide it. But think about what that money could have done for other aspects of healthcare. So we will be having talks with the Ministry of Finance for the continued budgetary support. But that is what we have spent so far under three headings: infrastructure, HR, consumables. So infrastructure is building out all these facilities, upgrading facilities for both COVID patients, ICU capacity, all these step-down facilities, DB, UTT, paying for quarantine, consumables, PPE, equipment, ICU equipment, and so on. So it's a big undertaking, and all of this has been provided at absolutely no cost to the COVID patient, but the taxpayer. And we must thank the taxpayer for this, because we always thank the healthcare workers, and I thank them again, but let's now thank the taxpayer. The taxpayer has rushed to the rescue of Trinidad and Tobago to the tune of $480 million. That is almost $500 million TT dollars. That is the direct financial cost. So thank you for raising the issue.
Thank you very much, Minister. Now to CNC3, please.
Hi, good morning. Soini Gray from CNC3. My question is for the Chief Medical Officer, Dr. Parham. Good morning. We have noticed an increase in the number of suicides or reports of suicides reaching our officers. Yesterday was Suicide Prevention Day. September 10th. September is Suicide Prevention Month. Have your colleagues also noticed this? Has the Epidemiological Office noticed an increase? And what are you all doing to address that if you have? Thank you.
The issue of suicide is a multifactorial sort of issue. I think the Ministry of Health would have been collaborating with the Pan American Health Organization all the way back since 2017, when Trinidad was listed as one of the 3 top countries in the CARICOM region to have a high rate of suicide. So we had started that sort of program. For about the last 4 years or so, we have been working very closely with them. And as I said, it's cultural as it is multifactorial in nature. So it requires a public education campaign that really speaks to that level of counseling. There's a program out of the Ministry of Social Development, as you know, that also assists. So it's a all of government, all of society sort of approach that we have been taking. The numbers have not changed significantly in terms of the percentages for the country over the last 3 or 4 years, roughly around the same number we have been seeing. And in our press release, I think we would have stated what our rate was at for this year. So the prevalence is not really decreasing over the last 4 years, which is something that we were hoping to see by now with some of the interventions that we put in place. But again, we will continue to work with all our sister agencies in that regard to get down to there needs to be some level of counseling, I think, at the individual level. There's a lot of family support that needs to be given in a lot of instances when you look at the individual cases. So we will continue to work with both PAHO and all of the sister agencies to try to address the issue as best as we can.
Thank you very much. Now questions from Newsday, please.
Good morning, Janelle D'Souza from Newsday. Minister, you recently announced that you'll be having vaccination sites at schools. When and where will this begin? And is it just for the students of that particular school or students in the district?
Thank you very much. Yes. So as a follow-up to that announcement, the Minister of Education announced when this will start and how it will start. So we will be supporting the Ministry of Education in that particular initiative. Okay? So let's wait for the Honorable Nyan Gatsby Dolly to make that particular announcement as to the details of the rollout for schools. Thank you very much.
Thank you, Minister. And we go quickly into additional questions. Let's get one additional from CL Communications, please.
Hi, good morning again. I was just curious, what is the vaccine uptake in the Victoria County, given the fact that the cases had increased, or I think the numbers had increased a lot? Okay, so that's basically what I wanted.
Thank you. So we don't have data by county. We have data by regional health authorities. So under Southwest Regional Health Authority, where the County Victoria will fall into, and all other counties, is 130,251. However, the particular issue with County Victoria and other counties that we have flagged. So let's start. Since the start of this wave in April, was it April, CMO, I believe, we started to flag County Caroni. Then we saw the cases started to increase in County Victoria. County Victoria continues to be a constant source of concern. Other areas that have been sources of concern are Tobago and St. George East at one point in time. So those four counties with County Victoria and Tobago, the numbers tend to be skewed because if you disaggregate it as Dr. Hines does from time to time, you see that those two areas, County Victoria, County Caroni to some extent, and Tobago, affect the way the national numbers look and affect the national response. So because of particular dynamics in County Caroni, County Victoria, and Tobago, they do affect how the rest of us have to live or not live. So the basic premise is, wherever you live, whichever county you are in, because only 510,000 adults have been vaccinated, get vaccinated. We have another 500,000 adults to vaccinate. We have another 60,000 school-age children between 12 and 18 to vaccinate. If we want to have a state of normalcy or near normalcy, the solution now is vaccination. And I am hoping that the country does not get numb, because I have a feeling this is happening, that we may be getting numb to the daily death toll. It is still too high, because since we started this mass vaccination drive with the advent of the Sinopharm vaccines, over 1 million, by now nobody should be dying, because everybody should have had a chance to be fully vaccinated by now. But let's not get numb to the daily announcement, 5 persons have died, 7 persons have died. These are real people. These are not statistics. These are real families every day being plunged into a state of mourning. It may not affect me or a particular individual, but this is our fate if we don't vaccinate. So on the glass half full, 510 persons. Glass half empty, another 500,000 persons to go. 12 to 18, 33,000 vaccinated. We need another 67 odd thousand to go. So, those are the two sides of the coin that we are dealing with. At the end of the day, regardless of whether it's County Victoria, County Caroni, Tobago, get vaccinated. Thank you very much.
Thank you very much. And our last question today will come from TTT, please.
Good morning, Terry and Brown Campbell from TTT News. My question is to the Health Minister. Has there been any increase in the number of healthcare workers, nurses, etc., who have accepted the vaccine? Thank you.
Terry-Ann, the answer is yes, and I'm going into my phone to give you the figure. And Terry-Ann, let me say, it's so nice to see you without a mask. Let me say that. So if you allow me to go into my phone and give me a second, and I will keep you company by just saying it's so nice to see you without a mask. Yes.
Okay.
Right. Healthcare workers who took advantage of the opening up of Pfizer, 444. Yeah. So 444 extra healthcare workers have taken up the offer of Pfizer. So that doesn't move the needle that much, but we are thankful. And we continue to work with TTRNA, the GMs of nursing, to give them the information and move them towards full vaccination. Thank you very much, Terry-Ann.
And we've come to the end of the Q&A. And Minister, I go right back to you for...
Again?
Yes, Minister.
All right.
As we go into your closing statement.
Thank you. So, ladies and gentlemen, I really want to thank you for the stimulating questions that we have had today. I haven't been at a press conference for a couple of weeks. I want to close off with a real doctor. Everybody should know him now. And he is going to make some statements in a video that he posted. The same way I asked the population not to become numb to the 4 or 5 persons dying a day. Also realize that our population has been basically spared the trauma of not having a hospital bed for non-COVID related matters, as opposed to many other countries. Many other countries, people are dying and cannot get treatment for non-COVID related matters. I just want to play you a short 2-3 minute video that emphasizes this point, that this is our future if the Delta variant gets hold amongst a largely unvaccinated population. 500,000 adults still have to be vaccinated. Just pay attention to this video for me, please, for a couple of minutes. While the video is being loaded up.
Classic. Hey, I feel like I wouldn't be doing my job if I didn't say something. This COVID is awful. You guys know that. There's so much misinformation out there. We are drowning in people who are dying with this illness, but I have yet to admit a single person because of a vaccine-related incident. Don't want to be political. I just need everybody to really know, in over 20 years of doing this, I've never been this busy or this stressed or seen this many sick people. So if you know somebody, give them a reassuring hug and tell them to get their vaccine. And don't be stupid and do dumb things, because there's no place to admit you. If you get sick, you're stuck with me until a bed opens up somewhere. And that might take days because they're all full of COVID people. So that's it. I'm pooped and I'm tired. I think most of the world is too. But we are in this together, and when people get political about it and try to pretend this doesn't affect them, they're wrong. Even if you get a mild illness and you pass it on to somebody else, that's a hospital bed that I can't send a hip fracture to or a heart attack to. In my ER, I had to hold on to a meningitis case, a stroke case, a heart attack, and a blood clot in the lung. And these are all people that should have been transferred out to ICUs right away, and there are no ICUs in the state of Iowa. They're all full. So this is bad. It feels like a third world country sometimes. So get your shots, people. Get your shots and tell people that you know and love they need to get their shots. That's the only way we're going to fix this thing. Thanks.
Thank you. That was Dr. Lance Van Gundy, a real doctor. We researched him. This is not a conspiracy theory or a fake doctor. He's a ER medical director at Unity Point Health in Marshalltown, Iowa. He was also interviewed on CNN. Ladies and gentlemen, as we close, the key takeaway message is, 1, vaccinations are safe. Vaccinations is the only way out to some sort of normalcy for both adults and children. 2, don't become numb. Don't become apathetic to the number of deaths and cases that you hear every day. There is this tendency when you get overwhelmed with information to just dismiss it. real people, real citizens of Trinidad and Tobago are dying. And many of these deaths are preventable. 99.9% of the persons currently dying are unvaccinated. Correct, CMO? 99.4. 99.4% of the people dying are unvaccinated. That is a tragedy. Those deaths are so avoidable if we just get vaccinated. So, as I close, I urge all citizens, whether you live in Trinidad, and especially in I really love Tobago and I really love Tobagonians. Get vaccinated. As I say, those who are encouraging you not to be vaccinated will not be there for you when you need help. Just get vaccinated. Do it for yourself, do it for your family, and do it for Trinidad and Tobago. Thank you very much.
Thank you very much, Minister. And as we come to the end of today's media conference, we reflect on the words of Minister and the message in that video. Today's Caribbean Wellness Day, and I hope that we will take the time to pay special attention to our health, not just healthy lifestyles, of course, but following the 3 W's and, of course, getting vaccinated. And please take the step today. 1 shot and you're done. At the malls today from 1 to 6 p.m. Long Circular Mall, West Mall, Starlight Shopping Plaza, Trin City Mall, Gulf City Mall, and C3 Center. Everyone, please come out between 1 to 6 and let's vaccinate TNT.
This is TTT. Live for local.